Hi, welcome to Into Health. Today we're going to talk about ulnar neuropathy, which is basically a condition that can cause different problems along the hand, the elbow, or even up here on the collarbone. The ulnar nerve is a nerve that runs from the lower part of the neck, so C7, C8, T1, but that's where the nerve comes out of the spinal cord, and then goes underneath the collarbone into the armpit and inside the arm, okay? So the ulnar nerve ends up on the inside of the elbow and then runs on the inside of the forearm and then ends up in the last two fingers. So if you've got an ulnar neuropathy, you can have pain under the collarbone, pain in the elbow but on the inside of the elbow, which is called the cubital tunnel syndrome. Or you've got pain, which is like nerve pain of the last two fingers, so the fourth and the fifth finger, okay? So you want to, there's few things that you need to do. First, we need to mobilize the neck to just create some movement in the neck and release any blockage or any nerve pinching in the neck, okay? So what you want to do, you want to sit upright. The position is quite important. So you want to be off the chair and bring the knees down so that your pelvis is in the right position, and then bring the chest bone up so that your spine is in line and your neck is in line with the rest of the spine. And then what you want to do, you want to look down towards the floor, looking up towards the ceiling, look straight ahead, look towards your right, look towards your left, and then you're trying to bring the ear towards the shoulder without lifting the shoulder, and then you do it on the other side. Then roll the shoulders back, and you're going to do it one more time. So you're looking down towards the floor, looking up towards the ceiling, look straight ahead, look towards your right, towards the left, and then you bring the ear towards the shoulder and the other side, okay? The next stage is that you're creating some movement in the shoulder. So you're shrugging the shoulder up towards the ears, you count to 5, and then you release it. Now squeeze the shoulder blades together. So first you're bringing the shoulders up, and then you're releasing them, and then you're basically squeezing the shoulder blades. So you're bringing the shoulder blades together, okay? So it's two movements here, shoulders up towards the ears and then drop them back and squeeze the shoulder blades together. Then bring them up towards the ears, rotate them back, squeeze the shoulder blades together. You're gonna do 10 of this, okay? And then you're gonna do the movement at the elbow. So imagine this is the arm that's got the pain. You're bringing the palm up to touch the shoulder as far as you can get. You hold it there for 10 seconds. And then you straighten the arm as much as you can. And then you're gonna do it one more time, hold to 10. And you straighten the arm again, okay? And now we're gonna do the movement about the wrist. So you're bending the wrist as much as you can. So the arm is forward, you can rest the arm wherever is comfortable. And you're bending the fingers down. So you're pointing the fingers down towards the floor, and then you're pointing the fingers up so the palm is coming up towards the ceiling. And then palm down, fingers down, and then palm up towards the ceiling, okay? Then the next movement you do is you're flexing your fingers at the biggest knuckle, okay? So the fingers are straight and you're just bending the fingers. And you're holding this for 10 seconds. And then you straighten up again. You do this 3 times, and then you increase it up to 10 times. Obviously, all these things you can do also if you're watching TV. Most of the time I tell my clients to just put a reminder if you know you're watching a program on TV and there's adverts. On the adverts, you just do the exercises, and by the end of the program, because normally there's about 3 adverts, you would have done all the exercises and you would have done it pretty well, okay? Then you want to create strength in between the fingers, okay? You can also use it by putting something in between the fingers and squeezing them together. So basically what you're doing is you're bringing the fingers together and squeeze, okay? Then you're bringing these 2 fingers together, squeeze. Then you're bringing these 2 fingers together and squeeze. So you're doing index and middle finger, middle and ring finger, and the little finger, okay? And you're doing this again 3 times, and then you increase it to 10. If you want to, if you're finding this difficult without anything in between the fingers, then you just put something in between the fingers, like a pencil or a pen, and you're squeezing in between, okay? Once you get stronger, then you don't need the object in between, you're just doing it with the fingers to finger, okay? And then you're holding a ball, and you're squeezing the ball, counting to 5, and then you release it. Squeeze the ball, count to 5, and release it. Squeeze the ball, count to 5, and release it. So you do it 3 times. First you count to 5, then you count to 10, then you count to 15, okay? Be careful when you're doing these exercises that you're not, there's gonna be some level of pain, because obviously you're gonna be very restricted in these areas. But as long as you're doing it slowly and methodically, you will see that the pain starts to reduce and you've got more mobility in the arm, okay? Thank you for watching, and if you like this video, please subscribe to Into Health, and then you can also ask for notifications so you'll be notified when there's new videos coming up. Thank you for watching. See you on the next video. Bye bye.